Over the past 2 decades, mental health has emerged as a prevailing problem in the United States. Although the U.S. has devoted an immense amount of resources to studying and combating the rise of mental health issues, some people are more susceptible to mental illness than others.
Military service, mental illness, and suicide have a pretty direct correlation. When we take our sons and daughters of America and send them to very adverse situations to include war, sometimes the scars that they come back with are unseen. They're unmasked, and they can tragically lead to suicide if not identified and treated early. For veterans, it's much more difficult to ask for help because they've been taught most of their career to be strong, to not be considered any perception of weakness, and that personal stigma gets in the way of seeking help. And so that traditional therapy has to have a cultural competency to understand how to talk to military members, how to talk to veterans, to get them into the right place.
One of the reasons therapy can be tough is that finding a therapist who is right for the individual is hard. Without a true cultural connection, some aren't open to talking to a therapist and end up quitting sessions before true change or insight has been gained.
Veterans are more at risk for suicide because we've taken them from their social norms, their social support, and then we've placed them in very adverse situations to include war. And when we've done that, we've put them under stressors that they've never experienced before. And we then can either unmask or manifest some of those stressors in the form of mental illness. The government has thrown a tremendous amount of resource for the veterans to try to get them help. The VA has done a community care network program which allows the veteran to make choices, to go to the community to get resources, innovation, and different modalities of treatment that the VA does not have.
Mental illness requires care and treatment that most of our citizens and veterans aren't getting. Therapy takes time. Healing is a process. With modern therapies, the Family Care Center based in Colorado Springs is championing a new procedure.
The Family Care Center is a comprehensive outpatient behavioral health system serving all ages. Our primary mission is to take care of military family members and the veterans. But we've seen such a huge need in the community that we've opened up with multiple different kinds of insurances in order to meet those needs and deliver quality behavioral health care. Transcranial Magnetic Stimulation, or TMS, is a non-invasive approach for treatment-resistant depression. We take a magnetic pulse and put it into a specific area of your brain that we know is not working very well with people with depression. The response and remission rates are incredible, and they alleviate those depressive symptoms in the majority of patients.
Therapy to those in need can be vital. TMS may be able to help with the rising tide of mental health issues brought on by prolonged social isolation.
I was about 16 years old when I started actively seeking treatment for depression. I was struggling so hard, but nothing helped. I tried countless medications over the next 10 to 15 years. Nothing worked. In fact, it made it worse. It got so bad, I even was trying to take my own life on a daily basis. I ended up in the hospital. I ended up in a coma. Finally, my mom found TMS. And had she not found it, I would not be sitting here right now telling you this story. By the time my mom had found the TMS treatment, I had completely given up. I had no hope left. So every day, my mom would drive an hour to come pick me up and drive me to my TMS therapy. I was not happy about it at all, but I was doing it because she wanted me to. And then suddenly, after a couple weeks, I was getting up out of bed on my own. And then soon after that, I was getting dressed. And then soon after that, I was driving myself to treatment. And now I'm in remission. TMS was scary at first. It can be intimidating. but it's not painful, and everybody at the Family Care Center is truly caring and kind. And if you're honest with them, they'll help you through whatever you need. I know that from personal experience of working with Dr. Weber, that as long as you're honest with him, he will literally do whatever it takes to get you where you need to be. 2 years ago, I had no plans for my future. None. No plans. Because I didn't think I had a future. I have a future now. And now I know why all those things happened to me. Everything that I went through in the past, all the pain and suffering, everything makes sense now because I can be here helping others find out about TMS and get the help that they need.
Family Care Center and all of its modalities, to include TMS, want to expand to not only the Colorado Front Range area to address our military family members and our veterans, but also our local community. We want to take this expertise to other military bases, the surrounding cities, and other states, so we can actually try to bring quality behavioral health care to everyone. Now, TMS has a lot more modalities that will be opened up. In fact, Europe is already doing panic disorder, schizophrenia, substance use, beyond the major depressive disorder and obsessive compulsive disorder that we have indicated currently in the United States.
To learn more, contact us today